Have you heard of stimming? If you have, it's probably in the context of being in the autism world. So today we're talking all about self-stimulatory behavior or stimming. Hi, I'm Dr. Mary Barbera, autism mom, behavior analyst, and bestselling author. Each week, I provide you with some of my ideas about turning autism or signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. So stimming or self-stimulatory behavior could be motor movements. It could be a repetitive lining up things and all kinds of things. It can be vocal, it can be verbal, it can be scripting. It's complicated, it's controversial. Today, we're sharing a clip all about stimming. Okay, so once you do an overall assessment, then we look at stim behaviors. What does the stim look like or sound like? How often does it occur? And so for the 2-year-old, I obviously couldn't stay there 24 hours a day for 3 days to get an accurate baseline. It wasn't necessary, and it wasn't practical, and we needed to get that rocking, banging out of the way as quickly as possible so that the lesion could heal, which it did. Within a couple of months of me starting with the boy once a week, the lesion did heal and he stopped head banging so much. And then I usually, like for the 6th grader, I recommended counting on a clicker, but this was a long, long time ago. This is more than a decade ago. So right now, I don't recommend counting stim behavior like I got 500 times a day. We only did that for like 3 days straight, and then we were able to switch it to a partial interval data collection form, which I talk more about in my online courses. But even with the 6th grader, we had a clicker and we clicked how many problem behavior, how many nonsense language scripting he did. But we would clear the clicker every 15 or 30 minutes, I forget what it was, and we would write down on a partial interval form, he was in spelling and he had 30 scriptings. And then he was at lunch, and this is the number. So we would clear the clicker so that we not only had how many times he scripted, we could identify, which is the next point on the assessment, which activities was producing a lot more scripting than others. And what I noticed for the 6th grader is he was learning to type. And when he was in typing class, he had almost 0 scripts because his mind was busy. He was getting enough reinforcement and enough at his own level demands. And so during the typing class, he was great with his scripting. So then we noticed, okay, which activities have the highest scripting? We actually ended up doubling his typing time. And all throughout, I worked with this boy from 6th grade until he was 21. And in the end, we really needed to look and find a job for him post-graduation that involved really keeping his mind busy at the right, keeping him really busy so that there wasn't a lot of time for this nonsense language. Overall assessment: what does the stim look like and sound like? How often does it occur? And what activities does it occur a lot in? And what activities does it hardly ever occur? And that is going to help you go to step number 2, which is planning. I hope you enjoyed that excerpt from podcast 230. If you did, you can listen to the whole podcast by looking at the description below. And for more information about how you can take the free 10-minute digital assessment to help your child or client today, you can check out marybarbera.com/assessment. All the details are below. If you like this video, I would love a thumbs up, share the video, or leave me a comment. And I will see you right here next time.